Hello everyone, my name is Asma Ahmed. I'm a postdoctoral research fellow at the Hospital for Sick Children in Toronto, Canada. And I'm here today to summarize our study on the prevalence and temporal trends of cerebral palsy in children born in 2002 to 2017 in Ontario, Canada. That was recently published online in the Developmental Medicine and Child Neurology Journal. Cerebral palsy, CP, is the most common cause of physical disability in children. Studies that examine temporal trends of CP rates in Europe and Australia have reported declines in CP prevalence in recent years, but the evidence from North America is still limited. In fact, no study so far has examined time trends in CP prevalence in Canada, and therefore there is a need for recent data on the prevalence and temporal changes in CP rates in Canada to better understand the disease burden. Also, little is known about changes in CP rates by important population characteristics over time. Examining these trends may shed a light on possible determinants and can help better understand the underlying causes of CP. Our first objective was to estimate the prevalence rate of CP in Ontario, Canada among children born in 2002 to 2017, both overall and by important sociodemographic characteristics. The second objective was to describe temporal trends of CP rates over the period between 2002 to 2013 overall and by population characteristics. We created a population-based longitudinal cohort using existing datasets from ICAS in Ontario, Canada. ICAS houses multiple population health administrative databases of all users of the provincial healthcare system. We identified all in-hospital deliveries in the province between 2002 to 2017, and after excluding missing or invalid records, our sample included over 2 million births. For overall prevalence, we included all births 2002 to 2017, and each child was followed until death or end of follow-up in 2018 to ascertain the outcome. For temporal analysis, we restricted our sample to 2002 to 2013 births to allow for an equal follow-up time for each child until the age of 4 years, as more than 90% of CP cases are diagnosed by that age. So for this analysis, our sample included over 1.5 million births. We defined CP based on either a single inpatient diagnosis or 2 or more outpatient diagnoses at least 2 weeks apart during the follow-up period. And we considered these child and maternal characteristics. The overall CP prevalence among children born in 2002 to 2017 in Ontario, Canada was 2.52 per 1,000 live births. This figure shows rates of CP in children aged 0 to 4 years per 1,000 live births by their year of birth. The blue circles represent observed estimates, and the red line represents predicted estimates with 95% confidence intervals based on a Poisson model with time trends modeled using restricted cubic splines. CP rates increased from 2.6 in the 2002 births to 2.9 in 2007 births, before starting a steady decline afterward, reaching a low of 1.9 per 1,000 live births in those born in 2013. These figures show rates by child characteristics over time. CP rates in children born preterm were more than 6 times those born at term or later, and CP rates in children born small for gestational age were almost double those born normal for gestational age, but rates were generally similar in those born normal and large for gestational age. Temporal trends by these categories were stable in 2002 to 2007 birth cohorts and steadily decreased afterward. Overall rates of CP were slightly higher in boys than girls, but considerably higher in children with congenital malformations compared to those with no congenital malformations, and in multiples compared to singletons. and we can see that CB rates by these characteristics were increasing until 2007 and decreasing afterward, but the gaps have narrowed in more recent years. This figure shows CB prevalence by maternal characteristics. CB rates were high in children of mothers aged less than 20 years and those 40 years or older, and similarly, we observed higher CB rates in children born to primiparous mothers and mothers with 3 or more previous live births. And these differences have remained relatively stable over time. This figure shows CB rates by quintiles of the Ontario Marginalization Index, going from quintile 1 in blue, the least marginalized, to quintile 5 in red, the most marginalized. There is some socioeconomic gradients in CB rates across these quintiles, with higher CB rates at the level of disadvantage increase, and these differences were most prominent for material deprivation. However, ethnic concentration was the exception, as highest CB rates were observed in children of women residing in areas with the lowest ethnic diversity. And when we examine these socioeconomic inequalities over time, these differences have remained relatively stable over the study period. So in summary, this study provides the most recent Canadian data on CB prevalence and the first study in Canada to examine CB rates over time. Our results showed that CB rates peaked in 2007 births but steadily declined afterward by approximately 3.5% per birth year. This study is also the first study to examine CB rates stratified by important birth and sociodemographic characteristics over time. In conclusion, it is encouraging to see declines in CB rates in more recent births, but there is still a need for continued population-based surveillance of the rates of CB to determine if these trends are ongoing. Future studies that describe temporal trends by CB subtype and functional status will help better guide service planning and provision. Future work should investigate the socioeconomic disparities in CB prevalence and also focus on recognizing factors that may explain the changes in CB rates over time. Thank you very much.